Hello, everyone, and welcome. Thank you for joining us for Helpsy's Hangout on Air. And today, our focus is on patient advocacy. In fact, we want to learn how the patient advocacy started and why it's important. And for this, I have a great guest with us. Her name is Suzanne. She's a 3-time breast cancer survivor, and she's a trained musician and medical massage therapist. And she's served as a patient advocate for many, many years. In fact, since 1999, since her first diagnosis. And she's done a lot of prominent work with Annie Appleseed Project, which is an organization for furthering the understanding and use of integrative modalities for cancer patients. And she works regularly with them, posting evidence-based studies and interviews with practitioners on her website. She's also worked one-on-one with many patients and families to answer their questions so they can be informed and knowledgeable when working with the medical team. So she has a lot of experience in patient advocacy, and she has prepared a great presentation for us to share about the patient advocacy work and what role patient advocates play. So with that, very pleased to welcome Suzanne. Welcome, Suzanne.
Thank you, Sangeeta. How are you?
Great. We're very excited to have you.
All right. Well, this is something that I put together when I met some doctor researchers when I was serving on a panel this summer, and they thought it would be a really great idea. So I put this together, and I hope people like it. It's probably one of a kind, since a lot of people don't understand what patient advocates do. And basically, patient advocacy has developed as the science and the technology has become more refined. So basically, this is about what patient advocacy is and what roles do we play. So giving my own personal history, in 1999 at age 36 and 5 months, I was diagnosed with breast cancer. At the time, they did not have a name for the type that I have. It's now known to be triple negative. And so I was told, we don't really know what to tell you, but you have cancer. So that spurred me into going to an organization called SHARE to find out something to do, since they had no treatment for me. Then everything seemed to be great with my treatment that I had. And then in 2002, I had a contralateral breast cancer, which, following my type that we found out later that I'm BRCA1, that it's common that you're diagnosed young, and it's common that you have a contralateral breast cancer. However, I was sort of ahead of the books. And then I thought I was in the safe zone until this 2015. On my birthday, I was diagnosed again. So it just is one of those things that keeps coming back, and you just need to keep informed. So that's basically why I became an advocate. There was no information, so I had to go on an information-seeking mission. And I did find out through things that I am BRCA1 positive, which is a genetic mutation, and I had the salpingo oophorectomy the following year prophylactically, and I just read a report yesterday that said that it's not really effective for breast cancer patients with BRCA1. But hey, at least they know that now. So this is, on the left is my grandmother and my mother. My grandmother, who I never met, died of ovarian cancer at age 42, and on the right is my mother, who was diagnosed with breast cancer at 36, and then had a long hiatus, 19 years, and then had a metastasis and passed away from that. So that's where my history comes. Cancer is seen as a problem in the US. When it was first discovered, many millions of years ago, they knew about cancer, but they didn't know what caused it. And now in the 20th and 21st century, we've had a lot of technologies that have developed so that we now know what cancer is and different things about it. But the first time that it was really seen as a problem and talked about in the United States was at the American Cancer Society started focusing on cancer and the treatment of patients, not just the disease itself. That was in 1913, and yet it wasn't until 1930 that the National Institute of Health started hearings to form a National Cancer Institute. And after the hearings, it didn't happen for another year that they established any kind of funding to investigate what cancer is and how to develop better treatments for patients. And it was another 30 years, or 40 years rather, until we had the first National Cancer Act to establish funding for research. So we were really not on the ball with that. But in the 70s, when the women's national prominence came, and there were a lot of women movements about other issues for women, all of a sudden cancer did become something that came into the forefront, mostly because Shirley Temple Black and Betty Ford publicly announced that they had breast cancer. It was the first people of prominence that came out and spoke about it, because of course it was the C word and no one really discussed cancer. It was in hushed tones and no one really knew much about it. So at that time, for people with breast cancer, the common practice was that you were put under anesthesia, you were given a biopsy, and then they didn't inform you ahead of time about what they might do, and immediately you had a radical mastectomy. And this mastectomy was called the Halsted, and it was named for Dr. Halsted. He was a very radical surgeon, and his philosophy was take it out, take everything out, take as much as you can, because the cancer will grow around the area. So it got really crazy where doctors were sort of one-upping each other as to how much they were removing. And it was extremely disfiguring. And of course, it didn't really work, but because he was so very prominent and he was at Johns Hopkins, it was difficult for doctors to change their thinking and to change their procedures. In the 1970s, at the same time, there was a famous patient, Rose Kushner, and she refused to have the Halsted procedure, and she chose to have a lumpectomy. And this was very controversial at the time. The other therapies that were available were the cobalt therapies, which were very, very harsh. And she was the patient who really brought about the first studies comparing the survival rates with the mastectomy versus lumpectomy. And if you can survive the treatment, many succumb as the body is not strong enough to overcome this. And everything was so harsh back in the 70s and even in the 80s that it was very difficult to make it through the treatment, much less have disfiguring surgeries. So another support organizations began forming based on personal experiences like Rose. People started speaking out because they felt that their needs were being unmet and they weren't being heard. So the very first organization for breast cancer that formed, of course, is Susan G. Komen. It was started by her sister Nancy Brinker after Susan struggled with her breast cancer, and she was diagnosed at age 33, which at the time was considered extremely young. And so advocacy started. People started talking about it more and finding out what treatments and what kinds of surgery, and they started questioning the surgeons and the procedures, and this was not well taken by the doctors because, of course, they were still very omnipotent at that time. But as patients put pressure on them, they have to start looking into something. So there was a bunch of well-publicized advocate-backed legal pleas, and the very first one of this was the stem cell transplant. It was not cleared for access by the FDA, only people who were in clinical studies. And this is an ongoing problem in the advocacy world, is that there are some very promising studies, but because of the way that we have set up our research system, it can't be given to just every patient who might qualify until after it's gone through 3 phases of human study. And this was very debatable because when we had the AIDS groups in the 1980s, they were also fighting for the same thing, to get access to treatments that were promising, but they hadn't gone through the whole clinical trial process that we have in place. So the first thing for the breast cancer was stem cell transplant. I actually had a friend that was doing this at Duke University, and many, many metastatic patients were asking for this. And actually they went to court, and some of the advocate organizations went to court believing that very strongly that this was something to save people. But as it turned out, after they did an accelerated process and were letting people into it, it was not an effective treatment. And so we learned a valuable lesson as advocates that we needed to be better trained before we asked Congress and other people to help us out. So they started looking at how to do this, and the National Breast Cancer Coalition is a very, very interesting group of women, lawyers and surgeons and journalists who went through the whole civil rights movement and the women's right movement, and they decided that they needed to apply the same principles for educating people as they did when they were looking at the women's movement. So they moved it from personal to political. And this does happen to people, but a lot of times people in Congress and businessmen aren't interested in hearing a personal story. They want to know what's in it for them. And so you have to move into a political strategy. So the grassroots people for that, for the group for this launching it was Susan Love, who's a breast surgeon and she's a survivor, Susan Hester, and Amy Langer, and Fran Visco, who is currently the president of the National Breast Cancer Coalition, was the person that really grabbed this by the horns and moved forward the agenda about how to scientifically train advocates. How do we do this? And so they developed something called the Project Lead. When I attended it in 2004, it was 4 intense days. Now it's 5 to 6 days. But as you can see, this was the book that we were given, and it's about 3 inches thick. And upon arriving, this is what we were given. And we spent 4 days from 7 a.m. until 8 or 9 at night with top experts in epidemiology and how to set up studies and the biology of cancer and cell biology and how everything worked. And it was really very intense, but we learned a lot, and it was good. And we had some presentations that we needed to make at the end to show that we had grasped most of the information. But this was what they started with. They started with this Project Lead, and you have to apply for it. And you have to be really focused on this because there is a lot of science, and it's a lot to learn and a lot to keep in mind as you're moving from one speaker to the next. This is a group of Project Lead grads who were at the Annie Appleseed Project a few years ago. So there are quite a few of us out there, and we all work hard every day in whatever capacity we choose to. Some of us spend time lobbying Congress. Some of us work on the state level. Some of us work just with people individually. And some of us do all of it. I do all those things. So it depends on your level of commitment and the time you have. There are some survivor patient advocates who attend a lot of medical conferences. And when this was first started in the 90s and the early 2000s, these advocates were not exactly welcomed at the different conferences that they went to. But Misa Mayer is a journalist, and she started writing up summaries of the major conferences. And some of the medical people did not like that because it was a lay person, but it was the beginning of taking the medical jumbo language and turning it into something that advocates or just your ordinary person could understand better than all the technical jargon that they like to use and sometimes hide behind. And so Misa's been very, very forward in embracing metastatic breast cancer, which was also another issue that once people were done with their treatment, they moved on and they didn't really want to think about developing metastatic disease. And those who did get metastatic disease were sort of shunned in a way, even by the breast cancer people, because no one knew about it and it was scary. And because of the fear, people avoided it. So Misa really took up this cause, and she's founded a website, and she also has authored a few books, and one of them is a guide to living with metastatic disease. Another person who is my personal hero is Anne Fonfa. I met her when I went to Share after I had been diagnosed with the unknown cancer, and she's an activist, and she really is a person who speaks to the natural community and to complementary and alternative therapies and looking at other ways to treat cancer, because one does not fit for every patient. So she has been instrumental in developing a lot of ins for other advocates, and so that we can get into these conferences and that they give us a special price. And there are now even some organizations that actually have a program where they bring advocates in. Now, I wouldn't say that they're 100% working as to how the advocacy community would like our involvement in these organizations' meetings, but it is a start. And here's a picture that's Anne on the left, and another great person, Johnny Immerman, who is a cancer survivor and started Immerman Angels, which is an organization where you can be matched as a patient with another survivor close to your age with the same diagnosis. Or they also now match caregivers. So if you're caring for someone, you can also contact his organization and they will match you with someone in a similar situation. It's a really great tool, and so people don't feel so alone in their diagnosis and what they're going through and is this normal. So it's two great people, two great advocates. And when I was in my second diagnosis and I was going through chemotherapy, my doctor in New York he's a very wonderful, giving man and very caring. And I came up with this saying, chemotherapy, if it doesn't kill you, it might cure you and most certainly curl your hair. Well, he said, please don't say that. But when you're a patient sitting in there, you kind of wonder, is this going to work? And while I'm going through all this, who's going to give me support? Because families don't always jump on the bandwagon. It really depends on how people have viewed cancer in the past. And that was my case. So it was really important to me to have something sort of humorous to keep myself going. This is my version of the scientist chart where they have all their things that are going from if this happens and this might happen and all of their foregone conclusions. And this is my example of how patient support started based on my personal experiences. On the top, you see the NBBC, which is the National Breast Cancer Coalition. It was one of the first breast cancer organizations, and it encompassed all women with all breast cancer. And as different subtypes of breast cancer were found, then you had different groups that felt that they needed a different kind of support, something more specific. So you see YSC as Young Survival Coalition. They started in 1999 because they were finding that there were these young women, but there were no treatments for us. There were no support groups, and we had young mothers and single women, and we just didn't fit into the typical 55 and plus breast cancer support groups. So I joined with them, and I helped quite a bit with forming some other chapters, and we were on different committees and really pushed the issue that young women were getting breast cancer and they were dying from breast cancer, and that we desperately needed some people to be looking at research and looking at us and seeing why it was different, why this was happening in such young women as young as 19 and 20. And then another group, SHARE, where I had gone, that's for women with breast and ovarian cancer. And I think that they've enlarged that now for any type of cancer. But they offer a variety of services and classes and speakers that come in to help women negotiate going through a diagnosis of cancer. Another group that formed was LBBC, is Living Beyond Breast Cancer, and they developed for survivors, for people once that they were out of treatment and you're back into the mainstream of living, but you don't really feel like you're in that mainstream. There's a wall between you and the rest of the world of the living. And so they offer a lot of services for people that are out of treatment and that may are afraid of the cancer coming back, or they have long-term side effects that they weren't expecting, or maybe they were told they were going to come, but they weren't expecting them. So they do a lot of those type of services. The Latina SHARE obviously focuses on the Latina population. And SHARE Charette is for young women who are Jewish heritage. There are a lot of issues with the mutations, and so they have a special group for that. The Sisters Organization is for African American women. They are disproportionately affected by breast cancer. And then, of course, the BC Mets, it's the metastatic cancer that we know that Misa Mayer was instrumental in starting. FORCE group underneath is stuff that I became involved with. FORCE is Facing Our Risk of Cancer Empowered, because we have a group of women who have the BRCA1 and BRCA2, and they're finding some other mutations. And that group works with people who are survivors who have a mutation, or also people called previvors, who are people who have the BRCA mutation, but they haven't been diagnosed yet. So there's different things that they can look at how to take care of their health more effectively with that known thing. And then the Moffat Centre for BRCA research, developed about 6 years ago, focuses solely on BRCA1 and 2 issues. Triple Negative Breast Cancer Foundation has become, that's what I was diagnosed originally, but they didn't have a name for it yet. And so they have people that specially look into that very small population. And then the other one on the left is MPBC, is metaplastic breast cancer, which I was diagnosed this last time, which affects 1% of breast cancer. But enough patients got together and decided it was important that they went from a Facebook support group to this global alliance where they contact different researchers who are working on this. And so the patients are very much involved with what's going on and helping to raise money and move the agenda forward. That went fast. Sorry. Okay. So then the other ones are just the Breast Cancer Alliance and the Environmental Working Group there below in the green. They are very big workers on issues for advocacy as far as working with legislative issues, and really they really push the buttons. They take no no's for answers. They just really push the envelope. Then the next one is the Genetic Alliance, and that's an organization that formed out of all these different genetic mutations for different kinds of cancers, rare cancers. And then as the world of genomics and genetics have explored, there are a lot more jobs and a lot more things that they're starting to look at people's genetic makeups and the genomic counts in their tumor cells so that they can understand more about the cancer and be more effective with the treatments that they do. Then the others are just groups you've probably known. Livestrong and the Doug Ullman and Planet Cancer were both young adult groups. They fell under the umbrella of Livestrong and National Cancer Survivorships, and the Patient Advocate Foundation and Cancer Care are all organizations that patients can go to if they're having difficulties with locating services or medications or something. And those are groups that have formed that help patients do that. So there are a lot of different places to get support and education, but you sort of need to know about it. Metastatic disease, the two young ladies in the middle were friends of mine that were very big advocates, and they both had metastatic disease. And the one with the checkered shirt was very, very big on pushing YSC. Please, we need to have some support groups for the metastatic girls. So they're no longer with us, but I think of them every day because I have their picture up in my room. And she was the person in YSC that asked them to please look at this dilemma and get some online support groups. And they also created a video called The Beautiful Eight, which interviewed 8 of them talking about their issues about, knowing that they were not going to have a long life and what they were going through and how it affected them. This is a very good friend of mine who was in New York, and she was an ovarian cancer patient. And she became an advocate because she saw what I was doing with breast cancer, and she wanted to do the same thing for ovarian cancer. And she has passed away now, but she added quite a bit in her time with us to help move the ovarian cancer patients into a better place. And there they are. There they are. Then there were new drugs that came out, and we started getting more approvals that we wanted out for things that were showing that they were having good results early. And so this is where the advocates come in, and they have to really do their homework and speak with some scientists to find out if these things are really working. Should we really be pushing for all patients to have access to them? Gleevec was one in the early 2000s. It was not being really used for breast cancer, and a lot of people I know were leaving the country to go and get it. Avastin is another drug that they started using, which unfortunately also did not pan out well for breast cancer patients. And the early PARP inhibitors, which are used primarily with people with the triple negatives, it was the first thing that they could have to treat with that. Some worked better than others. And then we have the aromatase inhibitors, which people who were premenopausal could take in place of the other medicines that everyone can use. And they work okay, but there are a lot of side effects which are detrimental to people. I had to go off of them personally. Fosamax is for your bones. that has its ups and downs, and Herceptin, which is used for people who have breast cancers that are HER2 positive. It's another therapy that they can give you. A lot of advocates attend medical conferences, and some of these listed. ASCO, American Society for Clinical Oncology, has a great conference, and they have started having separate survivorship conferences. I just went to one last month, which was good, but there's a lot of room for improvement. San Antonio Breast Cancer Conference, they have a special program from the Alamo Breast Cancer Foundation where they have scholarships, and it's just a complete advocate program where they have hot topic sessions for people to attend every day, and you can go to listen to some special speakers if you're a part of that advocate program. But there are also other advocates that come. That's probably the largest grouping of advocates for a conference in the country. And American Association for Cancer Research, they are very big on research and publications, but they're looking at patients to become more interested in research and clinical trials. So they've been putting out a magazine which is more of a translation of what's going on, which is quite good. Society for Integrative Oncology, they actually sponsor advocates to come to all of their meetings, and they have some really, really good things, and they're moving along. Then the National Institute for Health and National Cancer Institute have speakers that come in, but you have to be in the DC area to be able to see those. And this is just some people who have actually been long-term survivors. On the right is myself and my best friend, Kim, both breast cancer survivors. And on the left is who I call my little sister, Nikki. And unfortunately, when I was diagnosed in 2015, she and her mother were diagnosed about 5 months later, both of them again. And we're all doing well right now. So there are a few of us out there, but it takes lots of people to keep this going forward. A lot of us also lobby Congress and go to the state and local level things. And people for NBCC, there's leaders that are chosen and were trained prior to the annual May conference. And when you go in, you need to be sure that you have talking points that you go in about breast cancer legislation, why it's important to you, why it's important to breast cancer survivors as a whole, and what we can bring to the table, what we are willing to do to advance the cause. Do we need to make phone calls? Do we need to meet with researchers? What can we do as advocates to help move along the agenda? So generally, we're looking for research-based funding. There is some in the Congress every year, and some of it's is debatable, and some is just marked to continue on. But you always need to speak up to make sure that they know there are people who want those services and want that research money, and that we want to keep that funding level, or if possible increase it every year, because it is important to keep doing research. And this was one of my advocacy things. I worked with the Genetic Alliance, and I was honored there, and I had this was displayed at the National Geographic Society at the 10th anniversary. So just showed a little bit of something for all my time. And we also speak up regarding patient care, and this can be done on an individual level or through your local medical centers, or also I work with my state legislator on this, and writing letters about facilities, the cleanliness of the facilities, your access to the service, how the staff treats people, the wait times. I've done this at several places I've been at and actually got letters back in action. You also want to look at time from the diagnosis to surgery. Sometimes that gets a little bit involved and it's taking a long time, and patients need to know what their issues are with that, how much time they have. And also if there's access to specialists for unusual cases, if you have a rare cancer. Insurance issues, sometimes patients won't go in because their insurance is balking, and I just say you need to go ahead and deal with the insurance later. And most people don't know about that, and they will put off things that could be done just because they're unsure of the insurance. And then people have issues with transportation, childcare, living situation, paying their bills, just everyday life that keeps on going whether you have cancer or not. And access to social worker for applications to different foundations where you might get funding for services. And this is me and Sanjita hanging out at one of the conferences. So once in a while, we do get to have fun when we're advocating, and this is one of those moments. I also participate as a patient in a lot of research studies, and this is one that I completed at the National Cancer Institute. And I always work with patients, and I'll explain to them what a trial is, how to participate, and I also work with recruiting, with helping researchers who want to recruit patients to their study to find out what exactly they want to do, and I can point them to the best resources and websites to put up to recruit patients for the studies, because of course that's an important part of doing the studies. You have to have patients in them. There are some new studies, new types that have come out called basket and umbrella clinical trials, and these are basically where they look at the genomic makeups of your tumors, and you may have a group of 7 different types of cancers where they manifested breast or prostate or lung cancer, but they all have the same genetic variations, and they have drugs that they already know target certain genomic mutations, and so you can get put into one of those trials and see if that works. And that's a new way of looking at things instead of being so very specific, and a lot of people then don't qualify because they're so specific. So that's a new way to get people in trials. And then there's things called immunotherapies, and those are not chemotherapy, but it's a different type of thing where it helps your body fight the cancer just within your body without the chemotherapy. And now they're doing quality of life research. They now have some chemotherapy cooling caps that are available so that people lose less hair than they traditionally would. And there are a lot of new devices and drugs that are coming through, and patient registries and tissue banks, which they're trying to get funding to do more of that, so they have more access to patient information and tissue samples for research. This is another study that I did. It's a survivor study that was at University of Pennsylvania that I participated in, Project Hope. And this was the Lance Armstrong Summit. They had these, I don't know if they're still going on, but they had several of them in the early 2000s, and I worked at 3 of them. And it was a very interesting time where we sat down, a bunch of advocates and survivors and caregivers, and we talked about the different things that we were struggling with, and presented some solutions. We not just discussed the problems, but what could we do to solve them? And there have been a lot of things that have come out of that have worked really well. So I think that they were very good. I don't know if they're still ongoing, but they were really good at the time because it really got people fired up and looking at real life issues and how we could talk together and find ways that we could solve them. This is a research study that was 7 years in length, and one of the things we got to do as advocates is go to the breast cancer research laboratory at Fox Chase, and we were researchers for a day. So we were all assigned to a different task. We didn't use real chemicals or anything, but I was very excited because I was in the newest technology group, and we prepared a presentation and gave them at the end of the day. And I really liked the fact that we got to wear lab coats. That was cool. We also sit on boards. Institutional review boards sometimes are required to have a patient advocate for certain research studies now, and there's state and regional working groups within some of the different groups, and they also have advocates on those. There's the Cochrane Review that you can join, and the Department of Defense Breast Cancer Research Grant Reviews, which I participated in this summer. And then private organizations also have grant reviews, and Komen is the largest of these. We attend special advocate meetings like the ASCO, the Alamo, and the SIO, and then the National Genetic Counselor meeting had requested that theirs have some advocates that I went to at one time because they wanted to find out what we needed to know, or what we knew as advocates that we felt the patients needed to know. So there are groups who are starting to ask patients and advocates, what are the problems and what do you see as some solutions? Because we're in a unique position to know that, whereas our doctors and nurses and counselors don't necessarily know that. They don't learn that in their schooling. And I have had an experience with rare cancers that happens to be my life. In 1999, I had triple negative, but they didn't have a name or a treatment for it. And now we have the privately funded triple negative breast cancer research center, which is an answer to that dilemma that came up. And then I was also discovered to have the BRCA1 positive, and that was after my second diagnosis. I was in my 30s, which followed the textbook or the research at that time that's what they were finding, but I was ahead of them. And so based on that, I began participating with FORCE, Facing Our Risk of Cancer Empowered, to learn about new research and discoveries. And they post surveys and they recruit for trials and studies, which is generally how I find out about the studies that I participate in. And then they develop the Moffat Centre for BRCA research, and I have done several things with them since I have that. And then, as I mentioned, the metaplastic breast disease, which is very rare, it's 1% of all breast cancers. They had a Facebook group, and now they have formed this global alliance where they speak with researchers and really try to keep up on stuff. And actually, there were some good discoveries that were just released to the public last month. So that was a good thing. So those are some of the positive breakthroughs for me, but for patients overall, they have approved a new liquid formulation of THC. They have a better selection of antiemetics, that's anti-nausea drugs, the chemo cooling caps. There's integrative medicine is more accepted now, where people can go to a nutritionist, take meditation, yoga classes, get some acupuncture, go for a massage, use journaling, music, whatever, to help you deal with the spiritual and the mental side of the disease. And now they have much lower dose chemotherapies. They have lower doses of radiation. They have the basket and umbrella trials. And they also have training and more support groups for caregivers, which was a group that was ignored for quite some time. And patients are now encouraged to exercise and socialize, where in the past they were maybe shunned and stayed away from people. So one of the best things that I think advocates do is we inspire, empower, listen, and support others. And we do this by working with groups of patients in formal and informal settings, at hospitals, in their homes, at support centers, wherever, for me, wherever I meet somebody, I'll sit down and talk with them. But we work as one-to-one mentors. We're not a medical person. I do have a medical background, but most of my mentoring is through my personal experience and the experience of those that I have worked with. We listen and we provide information through the best resources available. We don't encourage people to go Google their disease, because there's so much information that's not accurate, that we can guide them to the best sources for their disease and the stage where they're at in their development. We also inform patients of the things that they control in their life, because a lot of people feel out of control, and we can help them to see where they can take charge of things. And we tell our stories to inspire patients and their families to move forward in the best possible way, to live fully, and to never give up. Don't be negative. And this is just some pictures of lovely people at the Complementary Medicine Conference, which I am lucky to attend each year, and I'll be going soon again. And there's some ongoing research efforts for funding, and this is always a huge issue, and this is where we need people to make phone calls to Congress and to write letters and send emails, so that all those things that come into your email box, you need to take a look at them. And it's sometimes it's just a matter of clicking and saying, yeah, count me in, or making a phone call to 202, which is the area code for Washington, D.C., and just leaving a short message about why you think that research is vital or why that funding issue is up. And they have the Cancer Moonshot. They have a President's Cancer Panel, which was really a big thing that Livestrong was a part of. The Department of Defense funding for cancer-specific research, which has several times a year where they have people that gather to go over the grants and award quite a bit of money for research. Then there are the university and the private sector labs, and you have independent funded subtype cancer research centers, such as the ones I mentioned for the rare cancers I have. And moving forward with results from the National Institute of Environmental Health Human Services, the 7-year study of breast cancer in the environment, which is the group that I was with, where we went to the day in the life of a cancer researcher. And researchers can do a lot. They can listen to us. They can listen for safer drugs. They can support trials. They can foster faster access to treatments. They can look at food and supplement compounds, which a lot of the medicines are derived from natural substances, but we feel that perhaps the natural substances would be good working with other drugs to help us so we wouldn't have as many toxic side effects. And always remember that your researchers can also call their state and national leaders to voice their support, because it's vital to their jobs and keeping their jobs. And so this is from a study that I've been in for a long time, eye care at the Moffat Centre. And they send little things every year to reward us for filling out their stuff. And I wish to thank the many advocates and mentors which I've had the privilege to study and work with over the past 18 years. And together, I believe we lift, inspire, and encourage each other when the best answers are slow to come and we lose many to this very complicated disease. And this was a thank you to the professors at Michigan State University. That's my little dog Zeno in his pink scarf from the Detroit Tigers baseball team, pink out the park, and his little leash. So with that, I would like to turn it back over to Sangeeta.
Thank you, Suzanne. That was wonderful. Thank you for sharing so much insight and knowledge. And wow, what a journey. And I have to say, I'm so inspired by all the work that patient advocates do. I've known you for a while. I've known Anne for a while. And it's still, every time I hear about the motivation, the self initiative, and how much kindness and courage you have to go through everything you go through and take time to help others, I'm really, really amazed. And we are all so fortunate to have you and other patient advocates who spend so much time working to make life better for others. So I have some questions for you and some questions from the audience.
Okay.
So we can go over those. So first question is, how do people find patient advocates, or, you know, if they're struggling with some health problem or some question, where and how do they find the right people that they can talk to?
That is very difficult, and something that we as patient advocates are trying to address with the different clinics, because generally there isn't a patient advocate. You can ask if they have an advocate. I know when I was at MD Anderson, it's a huge place, and they actually have people who are advocates that are paid. A lot of times you can go through your support group. If there's a support group for your type, you can ask someone there. You can also search Facebook. You can type in your diagnosis, your type, and a lot of them have closed Facebook pages. You can get on there and you can ask people if they know of somebody. Unfortunately, there aren't that many of us, and I usually find people find me because someone that I know has heard about it, and you know, I usually find people that way. I do occasionally through a support system that I go through, like at Gilda's Club. You might just ask there, because there might be patients that are there that are advocates that we're not like official, so we're not working there, but people that work there know about us. I recently spoke with a mother of a metastatic patient that was referred from the Lighthouse, which is at the lake house where I go, which is a support center for patients. So you kind of have to ask around, and you'll probably be hooked up to somebody. You know, a doctor might know it, or another practicer might know it, a massage therapist or an acupuncturist might know of someone. So I try to keep the word out with everyone that I see, and that's usually how I get calls. I wish I had a job doing this where I could just sit at someone's clinic all day and have people come up and say, what are you dealing with today? How can I help you? But the medical establishment has not evolved, at least in Michigan and most other places, to where they see the benefit of having an advocate that can answer all these questions that they just simply don't have the time or staff to handle.
Right. So what about the nonprofit organizations? For example, like American Cancer Society has local branches everywhere. So does the individual cancer organizations, right? For example, the Breast Cancer Coalition or Young Cancer Survivors. Do they know about the patient advocates, or are they able to connect people to patient advocates?
That would probably be a good place to start, because it's more specific to your cancer type. And again, they usually know amongst their ranks which people are very active as advocates.
Okay, good, great. So that brings me to my next question is, what is okay to ask a patient advocate and what is not okay? In the sense, a lot of times you and other patient advocates are doing this as a volunteer work. You're helping people out of goodness of your heart. So what are some things that are okay and what might feel like it's too much to ask? So that way we know what is acceptable and what is not.
Well, you're right. 99% of advocates do this volunteer. I don't think any question is too crazy to ask, because we as advocates know our boundaries. And so if it's something that's beyond me, I will try to make a recommendation of where they should look for that information, or try to direct them to other sources, because of course we can't give medical advice. We just, based on our experience or experience of other people. But I don't think any question is too outrageous, because you have to ask questions to get answers. And if you just simply don't know, it's better to ask the question and be directed to the person that is best to be answering that question than to not ask it at all.
True. Yeah, that's a good point. It's better to ask and see if they can help. And I think I would say to our audience, it's important to recognize that many of the patient advocates are volunteering their time. They are themselves struggling with that health condition, or they have struggled with that health condition. And still they have been through it and they want to share and help you. So they're trying to devote some time to help you out, and they might be getting a lot of other requests just like you. So I think it's important to recognize that this is a gift, and be cognizant of their time and resources in terms of what we can help, what people can share. So do ask somebody, do take their help, because they know so much. They've been through this and are well connected to the resources, have been through that journey that you're going through, and can be a very valuable resource to help you live your life. And at the same time balance it with what's okay, what's not. I think one thought that comes to my mind, Suzanne, with this is, I know sometimes patient advocates are also open to doing this as a paid opportunity, where if somebody wants, they can hire a patient advocate for a few hours to go with them to the doctor. Is that something you have heard of?
Yes, actually, when I go to the Appleseed project, there are a couple people that I've met there who actually do that, or they will do research and look up information for people, and they do it on a paid basis, hourly or so much for like a set price, and they list the services that they'll provide. And there are people that do that. I just feel that from what I could do that for people too, but I have so many people that contact me that are friends or friends of friends, and I just feel that since I was given the gift, as you call it, to know about this and to be able to seek services and find the best things, that it's so exhausting and expensive while you're in treatment that I just feel it's a gift that I can give to the patient or their family to get them along to the next step, put them into a comfort zone, let them know what questions would be good for them to ask the doctor at the next appointment. And I'm actually looking into, it'd be great if I could get into like a doctor's office setting where I could just sit at a little desk, and when people come out of their appointments, they can walk over to me and I'll say, what don't you understand about what you just heard? Or where do you think you need to go next? And just do like a little stop, like a checkout, and meet with the patient advocate so that when they leave, they are more knowledgeable. They have a phone call that they can make, or they have a place they can go for a support group, or they have something, the next step that they can do. Because once you walk out of the doctor's office where you're their patient, then you become their survivor. And there's like a huge chasm between that the patients leave, and do they really know what's going on? So I think that patient advocates would be an asset to a big medical practice in that way. So we'll see.
Yeah. Yes, I hope so too, for the great work that you and other patient advocates do, that I hope one day there is a way to get paid for it. But also for our audience, just know that this is always an option for you. Is you can feel free to ask that of the organization or other patient advocates if you want more time from somebody, if they would be willing to offer you that for a reasonable amount. And I've found that people have benefited from that. So Suzanne, that brings me to my next question, which people have asked is, what you are finding in your experience and in having served as a patient advocate, what are some of the biggest challenges that patients are facing?
The biggest challenge they're facing is understanding their medical team, understanding their diagnosis, understanding what the next step is, and being part of the team in making the decisions about their care, understanding what is happening or what the choices are, or if they're asking if there are other options available. And it's still, after 18 years from my initial experience, I still hear people with that, oh, my doctor said this or that, I didn't understand it. Do I really need to do this treatment? And those are the questions they should be asking their doctor, but there's still that chasm in understanding patients feel that there's not enough time, or that the doctor doesn't have time to answer them. And so there's still a ongoing problem with, I believe, with just the communication, so that there's a complete circle and everyone's involved and everyone understands to the level that they want to understand.
Right. So if I understand correctly, and this is important for healthcare professionals, if you're watching, to know, is making sure your patient understood what you are trying to communicate. I think a lot of times we get caught up in the jargon, or just directly discussing certain solutions without checking if the patient wants more choices and suggesting those choices. So Suzanne, are you saying that yeah, this is supposed to be the job of healthcare professionals, but we know that there is a gap in that communication, and there's also a time crunch that healthcare professionals face just because of the way insurance is structured, or other barriers. Right. So I know when I'm with a patient, I have just a few minutes, barely 5, 7 minutes, 10 minutes at the most, to be able to address all their needs and write all the documents that they need, which might not be sufficient time. So I can truly appreciate the gap that's there. So what you're saying is that a lot of times things might not be clear, or all the options might not be discussed.
Correct.
Is that right?
Yes.
Those are the main challenges.
Right.
Okay.
I mean, I would suggest, and I said this at the meeting I was at, it would be great if everyone had a little half sheet of paper while you're sitting out waiting in the waiting room, because we all know you wait more than 5 minutes. And it could just be a simple thing about, what's going on with you that day. Some open-ended questions, and you could take some time, and whoever you're with, think about it. And it could also work on your survivorship plan, which they're supposed to be available, but they're not really happening. It would be a good way to build your survivorship plan. When you go in, you see your nurse, when they're taking your blood and your temperature, they could be reviewing that and ask you, oh, well, what is this symptom that you're talking about? How is it affecting you? So they can gather more information and put some notes down. By the time you go into the room, where your exam room, you're usually waiting a little bit longer there. There's some time there where there's valuable time where that could be spent looking at that, getting it to the doctor, so that by the time the doctor comes in, or the PA, they've already heard about your issues from your side, from the interpretation from the nurse. They can address them, so that by the time you walk out, 3 or 4 people should have addressed whatever that issue is for you that day. And I think even if one issue is addressed, that's one step forward. But that generally doesn't happen, and it takes a paradigm shift with how healthcare workers interact with their patients.
Mm-hmm. True, yeah. Taking that initiative, preparing your questions, and then making that as part of the agenda for that conversation helps to bring it up and get those addressed. And I would also add that if all your questions are not addressed, feel free to schedule more appointments, because each appointment time might be limited, but you can schedule more appointments.
Yeah, you can always ask your doctor if you're in for a 20-minute appointment. You can say the next time, well, let's schedule you for 30. They can do that, but you have to ask. And part of the problem is patients don't know what to ask. Maybe they remember when they get home, because it's kind of, people are fearful, or there's anxiety when you're there, and if you write them down, you don't remember. When I go with a patient, I always say, we talk about it ahead of time, and I say, give me some kind of sign that if you become frustrated, or you're not hearing anymore, that maybe you just do this on something like that. And I know to step in and say, I'm here serving as Tom's advocate today, and I'm going to continue asking questions because it's a little overwhelming for him. And that way you can get more results out of your time. And sometimes people are just frightened to ask the doctor. They don't know what the answer is going to be. And sometimes you get doctors who don't want to be forthcoming with information either, because they don't know that the person can handle that, or maybe the doctor can't handle it. Some of them don't know as much about certain kinds of things, and they don't want to say they don't know. They can refer you to some research, but a lot of them are just so busy that they don't have time. So that's why I really feel that if a lot of the larger practices just had a patient advocate who was there every day, or 3 days a week or something, that they could schedule your next appointment and come in, the advocate's here that day, because so much could get answered, and they'd be meeting a great need and taking the stress off of their own staff.
Absolutely. So I think preparing your questions beforehand, asking them, so taking in charge of the meeting and asking what you need, and advocating for it so it gets addressed would be really helpful. Which brings to area that I think many of us, or many of the patients, struggle with, but we don't spend enough time addressing it, is the supportive care services, like symptom management, and what are the services that are available for patients. What do you recommend in terms of discussing this with the provider, or getting access to services?
A lot of times, some of the providers do have within their practice access to some of the complementary therapies, or if they walk out into their patient waiting room, they may notice that on a lot of the bulletin boards, they have flyers listed with, we have yoga class on this day, or we're doing meditation on this day. And sometimes it would just be a case of the nurse or someone walking the patient out there and looking and saying, we have all these things that are available. Why don't you take a minute and look at these and come back to the desk, and then you can ask to have your next appointment. on that day. Maybe Tuesday is yoga day. Why don't you do your next appointment on Tuesday, and then you can go to the class, and then you can tell us what you felt about the class when you come to your appointment. Was it helpful? Was it not helpful? And if you wanted to try something different that wasn't good for you, then there's options. But a lot of times I think that the healthcare professional has to lead the patient to that, because they don't really know. They might be apprehensive about it, not know about the services. A lot of them are listed right there. Or if you go to a support group from there, generally other people in the group are doing things. So you can ask, what are people doing? You know, I need to get out more. I need to move. And someone might say, I'm doing yoga, or I'm going to a chair yoga class, or there's a light exercise group or something that I'm going to. So really, it's unfortunately, as far as advances we are with other things, as far as, you know, linking patients with other services, that's lacking. So it's kind of word of mouth or flyers or the support group. But I would suggest, you know, talking to someone at your office if there's anything if they know about, or asking if there's a support group. And then usually there's enough people there that someone knows something.
Mm-hmm. Yeah, exactly. Those are really great ideas. I think seeing if there's a support group, asking your doctor, asking your nurse if they don't know or don't have time, maybe asking the front desk or health educator, finding support groups, because those would be good places to find different supportive care services and advocating for what you want. And that's something that we try to offer here at Helpsy, is access to all kinds of supportive care professionals for your health needs, whether it's covered by insurance or not. So here you can come and look for professionals here as well on our platform. But do try to get access to these services, because the symptoms can be long lasting, Suzanne, I think, as
Yes.
you and I know, it can be for years, and you don't have to suffer with it. Please try and get help, get some services that will help you to feel better and manage them better.
Right. And most of the classes that you go to are like a support group too. And you don't have to sit and talk about, I call it 12-step, because some people talk about it like for years, but you don't have to talk about yourself, but you can go in. It's a warm group of people. You can say, how are you doing today? Just a quick little thing. If someone's, you know, having an ongoing issue, oh, are you feeling better today? And generally, since it's a class setting, people keep it pretty short, and then you just go in. But it's, you know, it's people going through what you're going through, but you don't have to go through all the symptoms. You can do something good for yourself, something healthy, and get out and have like a normal exercise class with people who understand what you're going through.
Absolutely. In my opinion, the biggest gift you can give yourself is find the right support group when you're going through a health problem, because having people who are going through what you're going through just helps so much to have people in that same boat.
Very true.
As much as me as a healthcare professional or holistic professional or your family can help you, we haven't been in your shoes. So someone like Suzanne, who will be able to give you the empathy and just the life experience that will make it so much different, you know, make life so much different. So let's move on, Suzanne. I still have a few questions for you. So in the interest of time, I want to try and cover those.
Sure.
So what about when you do ask, let's say you request for some service or you request for some test, and you get a pushback from the provider, so or from the healthcare center, let's say, or insurance? What is your advice to such people?
I had to go through that this last diagnosis. Sometimes it's a matter of going to the head of the department and asking, putting in writing and saying, you know, I've requested this and I didn't really get a response except no, I didn't. Why is that? Why is it a no? Is there something else that can be done? Is there another way that we can approach this? Sometimes it's a test. You can go to the company that provides the test and tell them your specific situation, and they can advocate on your behalf to your practitioner and say, I understand that this patient has come to you, and why are you rejecting this? Sometimes they don't know that if the cost will be absorbed or if they're going to have to absorb it. And sometimes it's unfortunately just a matter that I say, are you telling me no because you are knowledgeable about this, or are you telling me no because you simply don't know? And when you put it to them that way, very bluntly, usually they're not expecting it and you get a blunt answer back. So it may be that maybe you need to find another doctor, you go to another specialist, go on, because every doctor doesn't know everything. And there's someone who may specialize or work with patients more like that. So I would say, go higher, go under, go around the wall.
Those are very good suggestions, Suzanne. It's true, I think it's important to push. And one thing that you touched on, which I think is really important for us to talk about just for a minute or two, is the cost factor, right? So a lot of times there might be ways to get, if you can afford something, to get the cost subsidized or get a grant, get the cost waived, or even when working with a practitioner, there might be a way to do sliding scale or something. Right. Do you want to touch on that a little bit?
Yeah, you can always ask the practitioner if they're, say, I'd really like to do this, but my insurance isn't going to cover it. And oftentimes they'll absorb some of it. If you need medications or a special medical device, there are foundations that you can go to for that. For medications, there's patient help programs, patient assistant programs for most pharmaceuticals, especially the expensive ones. So you can call, there's usually a number, you can go online to the pharmaceutical company, and they have a special division that just does that. I look at it this way, you don't know if you don't ask. And most places, they want to help you, and if you really want to get it, it might take a lot of phone calls and getting around. You might need to get a friend or a family member, someone involved to help you, because it can be very time consuming. But at the end, just ask. And if the first person doesn't know, then you ask until you find someone who does know.
I love it. Ask and keep looking until you find someone who knows. Such a great advice, Suzanne. Such a great advice. Very true. You might not find the first person, but eventually, if you keep looking, you will find somebody who knows. And I know a lot of people find you and Annie Appleseed that way, as they keep looking. So that's wonderful. You are doing such great work, and I hope that someone in the audience feels inspired to want to be a patient advocate and help other people. If somebody was interested in becoming a patient advocate, helping other people, what is your suggestion for them in terms of how do they get started with being a patient advocate?
I would talk to someone who directs your support group. That's a good place to whoever the director of that is. They might be able to point you in the direction of that. Or you might just be able to start out helping mentoring, just offer, I feel like I'd like to work with some other patients with my experience, and offer up your name and phone number so that if someone comes in and they have questions, that, they have permission that they just call you, and you can kind of just start out that way, just helping maybe someone in your local community that's just been diagnosed and doesn't know what to do or what kind of doctor, or if they're asking the right questions. So you can start out simply just by giving your name and number to be contacted by anyone who wants to reach out.
That's wonderful. Thank you, Suzanne. Thank you so much. So for our audience, just recognize that there are great resources and great people who've been through it and are so willing to help you. So do take advantage of patient advocates. And for healthcare professionals, I would say recognize where we are missing the boat, where we are not sharing enough information. And let's try to do a better job with that. Let's try to give our patient access to patient advocates and wonderful resources that are in the community. And the advice I love from you, Suzanne, was ask and keep asking until you find the answers, because there will be somebody who will help you get there. So I hope that this session has helped everyone to feel more comfortable and confident with stepping up, advocating for yourself, asking for what you need, and hopefully you can get what you need.
If you would like to check out
Thank you,
materials,
Suzanne,
please take
for
them
your
to the
time. I really
confirmation desk
appreciate it.
now.
Thank you, Sanjita.
Not be checked out after.
Thank you, everybody, for joining, and we'll see you again in a month.